to John. You can do your intro, John, and I think you've got some slides, haven't you, as well? You should be able to share. Thanks, John.
Yeah, morning everyone. Thanks for inviting me today. I caught up with Adrian about a week ago. He just said, if you're available, could you just come and tell us a little bit about what GM Active are getting up to, and maybe put to you guys the idea of that kind of collaboration which you're kind of doing already anyway through this platform. Some of you will know me already from my Swim England days. So I worked across the whole of the UK, whole of England, sorry, and a lot of background within the Northwest as well, covering a lot of swimming stuff for Lancashire. So nice to see some familiar faces again too. So I'll get straight into some slides that I've put together. There's nothing detailed particularly, just a real quick overview of some of the stuff that we're doing and how we've gone about it. So it will hopefully help. What Adrian also asked me to touch on was just around the Quest assessment, or the active wellbeing Quest assessment as well, just to touch on that, which clearly I'm not able to assess it within Greater Manchester because it'd be a massive conflict of interest. So everyone would be getting excellent if I did that. So so I don't do that, but I do go to other areas. So I did first one over in active not Harrogate, North Yorkshire, which is Harrogate based. So I went and assessed them recently. So I'll just quickly touch on that as well. So 1 second. Let's through my slideshow. Okay, is everyone able to see that? Just give me a quick thumbs up. Yeah, bro, thank you. Okay, oops. So all I thought I'd do today, I was really pleased that Adrian gave me a promotion and put me down as a CEO. I'm not a CEO, I'm head of business operations for GM Active, but but it's nice to be called a CEO anyway. So what I've done is put what happens when leisure acts like a health system, which ultimately is the direction of travel that I think we're all going along, to be honest, for leisure finding its new purpose, particularly kind of triggered off the back of COVID and all the rest of it. So which feels like a complete different lifetime ago now. So across Greater Manchester, what was the problem? Why was change needed? So providers were working in a separate way, and therefore we had really weak NHS connection. So for us, that was a big thing to have a stronger voice. 10 local authority areas working together meant that actually we would have a stronger voice. Equally, being able to connect with the combined authority through Andy Burnham as the mayor for now. So that was a really important thing to do. So we had fragmented provision, no system voice, rising NHS demand, particularly around that prevention and management of long-term health conditions, and that whole using leisure to be a big part of that prevention piece was being underutilised. We all know the stats that I think it's changed slightly, but ultimately 16 to 18%, something like that, our members have a health and fitness membership. So it's only just short of 1/5 of the population. What happens with the other 4/5 of the population? What are we doing with them to support, help, and make sure that a gym, leisure centre, whatever words we want to use it, are not exclusive to just the people that like wearing lycra and having a protein shake. So it has to be for everybody in a different way. So we were individually strong in our local areas, but actually collectively we're pretty invisible. And that was the big catalyst to try and change so that we could have better connections, stronger voice, and be able to work with the combined authority and others as well. So what did we change? Well, back in 2015, 2016, GM Active, I would have been back in Swim England at this time. So I joined GM Active just over 4 years ago now. But I was part, because I was on the board for Active Tameside. So I was kind of part of it from the very beginning, but in a different guise. So we decided to come together as a collective to form GM Active, and therefore we'd be able to work with one voice, make sure that we have some shared priorities, that we're focused on some outcomes as well. So same organisations, but completely different system behaviour, to make sure that we, as a collective, can really, and part of our strategy is therefore to really deliver against population health. So this week, Wednesday, Thursday, a number of us will be going to the NHS Confed Expo to actually learn what they're doing. I'm looking at the agenda this morning. There's lots of things that talk about the prevention agenda and things like that. So we need to try and be in that space as well, which I think is really important to do that. And I guess our biggest example has, and I'm sure you've all probably kind of picked up on this, has been our prehab for cancer impact. So it started as a pilot back in Salford, and now it is actually part of the pathway for cancer care for colorectal and lung cancer. Now there is an awful lot of take that we've actually created a health inequality by trying to break down a health inequality, because ultimately if you haven't got the right type of cancer, you wouldn't be part of this pathway as things stand at the minute. So we as a collective system, including not just Greater Manchester but nationally, really push to make sure that actually that we're all pushing against. We all know that the science is there and the evidence is there that whatever cancer you have, actually physical activity, movement, change in lifestyle behaviours, etc., can make an impact and can make a difference. So we need to be pushing that agenda really strongly with the NHS, central government, etc., to make this just part of pathway for all cancers. So our referrals, some stats. So referrals tripled from 604 back in the pilot stage to now. It's actually grown since that. So it's now more sort of 2,000 a year. We could continue to grow that, but obviously workforce demands mean that we have to kick back a little bit and say we can't say yes to everybody, unfortunately. But that's the nice position we would like to be in. Overall target is that actually we can support 20 in the future will be to support 20,000 cancer patients in the UK, across Greater Manchester every year. Participation compared to normal exercise referral schemes is much higher. So this is about 70%. We do have some concerns, as all exercise referral programs do, that the adherence after they've been treated for cancer actually drops away to about 47% adherence. So are we landing the message that says this isn't just about a prescription, for example, this is about long-term behaviour change and making sure that we continue. So, you know, I want to be open and honest. There is still some work to do there to get that behaviour change on. But now the big thing for us across certainly those 3 or 4 different cancer types is now embedded in the cancer pathways. So that's a real key thing, and that's what we are looking to do with this as our blueprint for all long-term health conditions as we move forward. Improved recovery and outcomes, a big part of that. The biggest one that's not on there, improved survival rates, which surely has to be the big thing. So actually, it has to be something that we continue to grow, continue to do. And so it's now part of treatment and not just considered as a nice to have or a nice add-on, and is funded on an annual basis. Then we go into, and I think across Lancashire, I don't know whether you're going through this process at the minute or whether you've already done it, but this has come from the state of life research that we've done. So I'm believing across Lancashire, you're starting to do this as well. So this was sort of the social value, or the economic value is probably more accurate, working with state of life. 8 out of the 10 boroughs were involved in this. We've got stats came from around 3,200 participants. There was a control group and there was an active group as well. The research, so there was two bouts of research went into this in terms of questionnaires. Actually, the value coming back, so the well-being value per person as part of exercise referral was just short of £22,000 per person. The health value was around 5,600 per person. There was equally some stats that talked about 19% of this cohort fewer visits to the GP. So clearly there is another economic value there that says actually we're not having to use NHS resources as much because they're going through this program. And then a huge one as well is plus 1.32 life satisfaction boost. I've only given you some really top line headlines here, and I'm sure you've got loads of questions on this. What I can do as part of the notes from this, Darren, if you want me to, is share you the full report, and you can look at it from a GM perspective. Take a bit of time to read, understand what all of that means, because I'm almost, I'd be willing to bet my mortgage on it that you will have similar stats that come out of this for Lancashire. So I'm happy to share the full report, and then you can take a bit of time just to really understand it as well. The key one for us is that this is actually then Treasury level evidence to the value of leisure. So there is something called the Green Book, page 5. Within that, we're now speaking Treasury language rather than just talking about social value, which I've been in. I was down at the all-party political group for swimming not long ago. We talked about social value. There was an MP there that said social value doesn't pay the bills, though, does it? Which was really frustrating to hear, but ultimately this kind of stat does pay the bills, or reduces the bills at least. Just very quickly then, touching on Quest for Active Wellbeing. So what's the purpose of doing Quest for Active Wellbeing? So you've got your Quest on a facility basis, and then you've got your Quest as Active Wellbeing. So where you may look at doing this, like Active North Yorkshire did, they would do this for the borough. So where's the service around active wellbeing and services like that they can deliver against? So very much around assessing your quality, looking at the evidence you've got of what you're doing, and linking that to NHS credibility. So are my active wellbeing, exercise referral programs, etc., accredited or have some sort of kite mark? Yes, they do, because they could have Quest Active Wellbeing. I'm not on a commission, by the way. I just think it's a good thing to do. So consistent standards, outcome focused system alignment by going through that pathway. What could it mean for Lancashire? So that quality and assurance, making sure that we're looking collectively around that evidence in the outcomes of where you're managing to achieve things. Again, coming into that NHS credibility, but equally the key part of the assessment is to actually, and I've worked with Lynn a number of times around some of the GLL assessments as well, that continuous improvement to actually say, right, where are the gaps here? How do we improve? How do we drive change? I'm sure you all know my line manager, who's Andy King. The reason Andy wants me to go out and do this is because actually we will make no apology for it. We pick up ideas of what's working in other areas and bring it back to Greater Manchester. So it works in two ways. Hopefully I can share what's working well for us, and equally I'll nick the best things and bring it back to GM as well, and therefore helps drive the standard of the whole network across the UK. Moving away, so coming back into the GM Active side of things, what have we learned? What would be our key messages? Relationships before structure, credibility through data, workforce is key. So we have things like transformational leadership. We have the Aspiring Managers program. We had an online digital induction. So we've collectively across the GM Active collaborative, there's around 3,600 members of staff. There's no point in us all sitting in ivory towers without everyone at the coalface knowing what we're actually trying to do and what we're trying to achieve. So actually working with an organisation called Future Fit, we created a flex platform which is specific to GM Active. It's called a GM Active College, where we have loads of CPDs, loads of workforce opportunity for everybody, regardless of sort of hierarchical status. And equally moving away from hierarchical status, everyone is important in this journey. The one thing that we use within that is thinking about that NASA analogy. What was the cleaner trying to do when asked? I'm trying to help put a man on the moon. So we want everyone working within our sector to say, and working across the GM Active collective, is to say, actually, I'm trying to improve the population health, prevention and management of long-term health conditions across Greater Manchester, and I'm here to help that. The balance of standardisation and flexibility, we cannot have a one-size-fits-all. As I'm sure you'd be very aware, Wigan, I'm sat in Wigan at the minute, very white, British, working class. You go over to sort of the more east side of Greater Manchester, Oldham, Rochdale, very different Muslim, Asian communities, etc. So it cannot be a one size fits all. We want to do some stuff collectively together. It also has to be a balance of what does a community want, how do we co-design things, how do we generate those pathways that are not just the field of dreams, build it and they will come type approach. Actually, it's co-designed. Some of the challenges that we've faced, so that alignment, the different priorities in different areas. In some areas, it might be that frailty is one of your biggest drivers. In other areas, it might be you've got a high prevalence of people having strokes. Who knows? So actually, that alignment, and equally, your local councils might have different priorities. But actually, it's trying to find the collective kind of purpose is a challenge, but not insurmountable. The culture is still one that's ongoing, if I'm brutally honest. People thinking that they are just leisure operators versus actually we are now part of a health system, and that is a big change, and takes a bit of time to get over there. The data in terms of the inconsistency of systems and being able to compare like for like and apples with apples is something that we continue to try and get over. So I think the state of life research is a big example of where we can use data collectively to really prove our worth and prove our success. And then resource coordination is needed. So if it is something that Lancashire were looking to do, to have an Lancashire Active or something like that, then yeah, there would need to be some resource coordination considerations as well. If you were to kind of think about going down that GM-Active type model as a county, there is huge opportunity. There's a huge amount of alignment, and I think actually what we do collectively together is be able to really show and push that impact on a greater scale, which I think is where we come at it. But there are some considerations around leadership. What would be your governance? What would be your best approach to do this, not assuming that Lancashire is the same as Greater Manchester in terms of what leadership structures already exist. What is your shared purpose, and spending time to think about what they would be, and what's the time, because there would be time commitment. So the board, the GM-Active board, is made up of the CEOs or MDs of all of the different leisure trusts or organisations. So there is a time commitment as well to do that on a voluntary basis, and people underneath the board as well. So we have 5 different working groups. We have a health one, we have a people development one, we have a children and young people one, we have a data and insight one, we have an environment and sustainability one as well. We need volunteers to sit on all of those working groups. So it isn't just time commitment for CEOs, MDs, etc. It's time commitment for those people that are involved in those key areas as well. Not saying that your areas would need to be the same. That's just where the way the GM-Active came about it. So the opportunity isn't necessarily about the programs, it's about changing and trying to behave like a system that is part of the health system instead. And that's it. Happy to share this slide deck. I'll share that. I'll share the report I mentioned as well. I think I've got a couple of minutes if anyone's got any questions.
I'll take you a quick one, John, if I can. Just in terms of the strategies that you've got, obviously over in Manchester, living well strategy, GM moving strategy, how does this work shaping some of those strategies?
Yes, so one of the things that we are looking to do at the minute is actually to rewrite our strategy. The original GM-Active strategy was written before those things existed. So we need to refresh our strategy as things move, because we didn't have Live Well, we didn't have the 10-year NHS plan and stuff back then. Actually, an awful lot of our original strategy was about COVID recovery. So it's a little bit out of date. We decided we were going to do it a couple of months ago, but we decided just to see what was going to happen with the local elections, be a bit more cautious, I'm not going to get political, but clearly there is a certain political party that we needed to wait and see what happened, and ultimately they have got an awful lot of seats. And what does that do? What does that change? Equally, we've now got a mayor that potentially will be hoping to try and get into a certain number 10, I think. So yeah, we just need to see what happens. But yeah, we will be looking to refresh and align with all of those things. There is one take, actually. Do we actually need a strategy, or do we need a delivery plan instead? Because ultimately those things now exist. We need a delivery plan that says how you deliver against the 10-year NHS plan, or how you deliver against Live Well example. So that's the direction of travel that we will take.
Well, thanks, John. Alex?
Thanks, Darren. Hi, John. I sort of came in a few minutes late to this, but I really enjoyed what I've heard so far, and I think a sort of cohesive way of everybody looking at the same thing in the same way is really important. I just want to ask about creative health. Is that included in this in Greater Manchester? Because I know that you have got a creative health strategy, and I just wondered whether that's part of this.
It is partially part of it, because each of the different leisure trusts are slightly different. So you've got Salford and you've got Rochdale, for example, that have arts and culture as part of their whole estate. And there are others where that doesn't exist. So it becomes a little bit harder to say arts and culture is going to be part of our strategy, because it's not necessarily everyone that's involved in it. So yeah, we do it as a bit of piecemeal, I think, rather than everybody. Although I was down in the Evolve conference last Thursday down in London, and one of the big presentations, one of the keynote speakers was about mental health, physical health in connection with the arts. So next board, I will be doing a report on that, saying actually that, there's an awful lot of evidence that came out of that session saying that arts and leisure working in tandem can actually have huge impacts. So
yeah, I just wondered whether it was possible to sort of evaluate in the same way.
There was a lady that presented last week that started producing a load of data on that. I bought her book, and I can't for the life of me remember what she was called. Daisy Fancourt. Yeah, she presented last week. So so she was starting to share some of that data, but because we don't all do it, it becomes difficult to do it as a GM thing, because it's not everyone that's got that within their gift.
Thank you.
Brilliant. Thanks, Al. Any other questions for John whilst we've got, I think, 3 minutes of his time before he has to shoot? Any other observations, comments?
You never know whether that's a good thing or a bad thing.
Oh, Graham, save the day.
Yeah, John, sorry. I just wanted to ask about the Quest Active Wellbeing and what that does in terms of the recognition for NHS credibility with health partners and what have you. How is that viewed by health partners at this stage?
Yeah, I guess it's one of the things that health partners will often say is that we're a bit of the wild west. And that no one's kind of accrediting our services, or no one's really assessing our services and what we do. So for me, it's about that accreditation and being able to prove that actually it has been checked, and someone has given an overview of whether it's working well, and actually that you genuinely have an improvement plan associated with that as well to make it better. I think, look, I'm not here trying to sell it. It's about kind of just driving up those consistencies and standards. So yeah, for me, I'm a big advocate that actually NHS go through lots and lots of vetting and accreditations to be able to provide their services. So if we want to be aligned to them, I strongly believe that we should as well.
Thank you.
One thing I will say, guys, I don't know whether you've seen it advertised. We are doing, and again, this will sound like a sales pitch. We're doing our exercise referral conference on the 7th and 8th of July. Here where I'm sat now at Lee Sports Village, so not too far from most of you. We've got a really stellar lineup with Ollie Patrick, Dr. Hussein, people from Scotland, people from Wales, NHS, so that we can learn from them, behavioural psychologists to help us with that. So day one will be very much around the story. Day two will then be actually sitting in a room and say, right, what do we need to do collectively next to make this better? So you'd all be very welcome to attend that, because I think it's not. We're working with LFX, so Graham Hind, which I know a number of you will be connected to. So it's a GM Active LFX event, and ultimately, I think the more people we get from all over the UK, we got people coming. I've seen the booking that's coming from someone from Fife, so people coming from far and wide. So yeah, the more people we can get in that room, the better. I'll share the link as well, Darren, as part of the slides.
Brilliant.
Yeah.
Thanks, John. One final question from Mark. I think we've got a minute left of your time.
Yeah, no, just very quickly. It's clearly the aspiration, that, isn't it? That's brilliant stuff that you've got going on in GM, John. I think the complicating thing in Lancashire is LGR, isn't it? And we're up against a timescale we've got the neighbourhood health plans that need to be set in place, I think by 27, 28, is it? So I wonder if just how we can link up at a northwest level to make sure that our health partners right across the northwest are linking into the, how leisure and health and wider district work can contribute towards the 10-year plan, and how we just use those local partnerships in Lancashire and the northwest and beyond. So it's just how we get our voice over as Lancashire in the same way that you are in Greater Manchester. But it's brilliant stuff.
Yeah, I would say thank you, Mark. What I would say is that Liverpool City Region are looking at this as well at the minute. So, and I do think as we move forward, actually, how do we create a stronger northwest voice as well would be really, really powerful, without trying to kind of generate another new body and become some sort of UK active regional arm or whatever it is. But yeah, I do think that collective kind of sharing of best practice, sharing of data, sharing of insight is the only way that we're going to improve and get things and make things better. So my offer to Adrian is whatever you just decide to do across Lancashire, happy to help and support you where I can.
Brilliant. Thanks, Mark. Thanks, John. I know, conscious you've got to shoot off, but really thanks for sharing your time with us today. If you can send over the information, slides, etc., I'll make sure we get them out with the newsletter and the recording. That'd be great. But thanks again, John, for your time.
All right. Thanks all. Let's
See you later now.
Take care. Bye-bye.
Really useful, that. Certainly for me, he's not perhaps involved with these networks, but really good oversight of what they're doing in Greater Manchester and how we can do that in Lancashire. Really insightful. So without further ado, handing over to Lynn from GLL, is going to tell us a little bit about the opportunity around the MSK hubs.
I don't know if you've got the presentation now, have you, Darren? I don't know whether it's useful to pull that up or...
I've not seen it. Are you able to share it or not?
Let me just see if I can share it. 1 second. I literally got it like 5 minutes ago, but some of the stuff on the slides might be useful. Let me just see if I can pull it up. If not, I can just talk through it.
Yeah, no worries.
Yeah, I'll just talk through it because can't find the slides.
If you sent the slides, I'll share them out with the newsletter as well. Okay, Lynn's just dropped off. Second, I'll try and get her back in.
Yeah, what not to do when you try to switch screen is click yourself off Teams. Yeah. So basically, let me just click that off. To give everybody an update, some of you might be aware of an opportunity that's arisen from the Department of Work and Pensions and the NIHR. It's the second round of funding which is available for the development of musculoskeletal hubs. The first round of funding was involved with a project around, what was it called? It was a delivery of a digital solution, and worked with UK Active, delivering that project across the UK. And it was very much a digital solution looking at things like escape pain and physical activity in the pool, and that proved really successful. The NHSE have done a scoping review, and the evidence and research isn't really quality. So they want to look at how they deliver a project, but alongside that provide some quality research and evaluation, so that they've got some quality reviews to be able to develop the MSK approach more appropriately. So there's £2.14 million worth of funding available. What they're looking for is a single provider, a social enterprise, to work to deliver 40 physical activity hubs, or MSK hubs, 50% of which must be in the most deprived areas. They're targeting adults with a MSK issue. Oh, you got them now. So yeah, so targeting adults with an MSK issue, areas with high waiting lists, areas with the highest prevalence of musculoskeletal issues, and areas of highest deprivation. 40 MSK hubs have got to be delivered by 26-27, which is the first year. So the full set of hubs have got to be delivered in the first year. In the first year, each hub has got to deliver 25 participants, which seems relatively low, but the second year, 27-28, they're looking for 180 participants per hub. The lead provider is almost expected to work as a consortia. So working as a consortia, we would expect the lead provider to work with additional physical activity providers, work and health supports, employer support, and any other type of physical activity or employment support you would imagine. The interventions can be face-to-face, in person, individual or digital, or anything innovative that's not being trialled before. They are quite keen at looking at in-business supports, a solution that could go into business, and they are looking for leisure and community providers. This is not NHS providers. This service has got to sit alongside primary and secondary care, and it actually needs to fit with, looking into it a bit deeper, most local integrated care systems at the moment are looking at something called Getting It Right First Time, which is looking at different services and how they improve different aspects of those services. And within MSK, there's a document called Further Faster Community MSK Services Handbook. And within that, there's something called community appointment days, which some of you might be aware of already. So the community appointment days are used to tackle really high waiting lists. So I can see how these community appointment days and the MSK hubs would fit really quite well together. In addition, most areas now have got Workwell, and the expectation is that we would work with Workwell as part of our referrals as well. The likelihood is, as I said, it will be one lead provider, but we would expect the lead provider to work with the local system. So just as a heads up, GLL as a national social enterprise, we're probably looking to submit a bid, having conversations with the local health system, and obviously looking at how, and having conversations with Adrian and looking at how we support local providers to get on board with that system as well. So I've made sure that we've had a local voice in terms of what that might look like locally for us. So part of the project is about us collaborating with the NIHR and ensuring that we're able to evidence what we're doing. And they're going to obviously provide research and data collection and make sure that what we're doing is evaluated, so that if we are successful and the projects are successful, then those schemes would be scaled up elsewhere. So it is quite an exciting and an innovative opportunity, particularly where we are locally as a Lancashire and South Cumbria piece, to be able to get our projects highlighted and across the piece. I'm not sure about if any other providers are actually bidding for this, but I would imagine there'll be other national providers looking at doing similarly. So I don't think there's anything else that I need to cover. Oh, one other thing was that the MSK hubs need to be, by the end of the project, locally self-sustained. When anything says self-sustained, to me, that means there's no funding post the intervention. So there's ways, we need to think of ways of how these services are going to be self-sustainable post the development of the hubs, whether that's with local funding or whether that's actually we need to make those services self-sustainable. That's one question that I've got, obviously, from the information that we've been given so far. And that's the evaluation aims just there on the screen for anybody that wants to have a look at them. Anybody got any questions?
Neil?
Yeah, hi, Lynn. That does sound really interesting. Lynn, does that have to be a social enterprise? Can a local authority not apply?
No, it's got to be a social enterprise, I believe.
Okay.
A charitable social enterprise, yeah.
Okay. No worries.
I'll be honest,
But not
that was going to
to
be
say
my
that,
question
obviously-
after we spoke last week. Sorry, Lynn. That was going to be my question. So,
Not to say that the local authority couldn't be part of the consortia, though.
Okay. So, I mean, the obvious one then is how we maybe link with yourselves, because you're at, I mean, I think at South Ribble, I suppose Tory, I don't cover, I mean, I don't look after Tory, but I have to represent them at these meetings. Yeah, I mean, we've got the other team member to talk to you, then, wouldn't it, at GOL?
Yeah. And like I said, I mean, obviously, it's not me that's bidding, it's the national team that will be bidding.
Right.
And what I've tried to reflect and say to them that, yes, it's great that we're getting a bid in to deliver the 40 hubs, but we need to be mindful that we are ensuring that we're working collaboratively at a local level. There'll be some degree of of national partners that could potentially help with the hubs. But really, if we're going to be place-based, then we need to be working locally as well.
Okay, yeah, okay. Okay, thank you.
What are your timescales, Lynn? What are you working to on this to get
so
Lancashire? I guess, is it an expression of interest next stage? What's the?
It's the bid submission's the 24th of June. So we've not got long, really.
And just use, I guess, going back to the data, like what John was talking about, is there any particular areas in Lancashire where data's high? You mentioned Workwell, obviously, in terms of MSK.
Yeah. I'd need to have a proper look at the data. That's one thing. They did supply us with waiting list data, but speaking with the North Cumbria team, I've managed to have a chance to have a chat with them. And Adrian's going to supply me with the right contacts for Lancashire and South Cumbria. It doesn't look like the MSK data is correct. It apparently through NHS England, a lot of the integrated care system teams don't report correctly. So, but as I say, Adrian's going to put me in touch with the right teams to get that proper information, so that we can make sure that we're pinpointing the right areas. And again, as I said before, 20% of the hubs need to be in the most deprived areas, and it might, obviously it's not going to necessarily be in a GLL area either, so we need to be working with partners.
Neil, is that a historic hand, or are you want to come back in?
No, sorry, historic hand.
No worries. Is anybody already doing anything similar to this, Mark? Paul, conscious you've been doing bits and bats of stuff.
Yeah, no,
Amy?
just my question really was one around Lynn. It might be worth you touching base. So there's some work going on in Fleetwood. Obviously, we've got our majoritively deprived area in Fleetwood for wire, and we've got a lot of MSK demand, as I'd see it. But LCC via a new, that they're doing a pilot in Fleetwood where they're looking at business intelligence and data. So it's called the Community Insights Hub. So there's a team that's working on that over the next 6 months. So they're looking at all sorts of health and deprivation needs data. So maybe if I just link you into that, and then there might be something that you can lift out of that.
Yeah, that'd be great. Thank you.
Yeah, thanks.
Amy?
Yeah, it was just a bit of both really, back on what Neil was saying. So obviously we were in the calls, you know, for the hubs, and I think it's like Lynn was saying, it's a thing of who is going to go from, because obviously each area we've got loads of stuff going on. There's already that connectivity with the MSK teams. We're already delivering work well across the patch. So it is, I don't know if it's a bit of a concern or not, but it is just how that's connected, because they're not going to release any sort of idea of who's putting a bid in. So you kind of go into it blind unless you can sneak his feet to another provider that's going to say, well, we'll go in it together. It's, yeah, it seems, I don't know, it just seems massive. It just have 40 that you've got to deliver across country, and then these have got to be up and running and thinking by October, haven't they?
Yeah.
So it's just going to be interesting about to make sure each locality that's delivering all of this is all really well connected in, because there's no point duplicating really good work that's already going on across the patch.
100%.
Yeah.
And that's why I'm really precious over MSK delivery, because obviously I know that you guys are delivering so much. We're delivering a lot in Cumbria. And like, I was really concerned, like you were, Amy, that I didn't want GLL to go off and start inventing all these projects that were going to replicate what's already happening. So I've really given I'm quite happy to share what feedback I've given in terms of how I think it should work, how the projects I think should work, and how, you know, other partners should be considered and how it should work locally.
Because that's that sustainability thing, isn't it? We need someone come in to facilitate it all and then be able to step away, don't we? Yeah.
Well, so Lynn, just taking this forward, obviously I'll pick up with Adrian about the data. What do you need from the network?
Well, I had a chat with Adrian, and what we've said is I'm waiting for feedback from our national team. I've fed back my input to the team, what I've had back from Adrian and what have you, and from the local ICS. I'm waiting for the connection from the ICS locally in terms of MSK. And then I think once I've got an idea of how the bid's gonna go, because I've basically put my hand up and said, right, I want to be involved in the bid submission. If I need any information, I'll come back to this group.
Well, Neil?
Yeah, so that was in your hand. Yeah, it's just the feedback really, Darren, about the fact that if they are saying it's got consulting enterprises, I can partly see where they're doing it. They are missing out on potential partners, potentially, because obviously it's how we get involved. Because if you look at, just take South Lancashire, West Lancashire's in-house, Tory's in-house, South Ribble's in-house. That's a big old chunk of Lancashire, but at the moment, in terms of sites, there are locally run, they're all run by the local councils. And there is the odd site that's maybe run by a school that's associated by, but they're slightly limiting the potential of partners. So I mean, I'm not going to die in a ditch about it, but it might be worth feeding that back.
Yeah.
Any other comments, observations? Go on, Christian.
Just probably echoing what Neil's mentioned there, that within Lancashire, how would we go with social enterprises where we're not sort of covered or connected with a partner? I didn't know if it was something that is something like Active Lancashire, a social enterprise, so then we could have consistency across Lancashire through maybe Active Lancashire applying for something like this as the standalone in Lancashire maybe. I'm not sure, but just how would we link in with third-party service providers? I did have experience with it at Everyone Active with Withenshaw Forum, and again it was how did we do them sort of social enterprises when we spread so thin with other competitors across the areas.
That's a great suggestion. We're on obviously social enterprise is Active Lancashire, but covers the whole area.
Yeah, I mean, obviously,
consistency.
yeah, I mean, obviously, Adrian and Lynn have been chatting about this, and I will feed it back to Adrian in terms of the next steps, and we'll pick that up with yourselves, Lynn. We've also got obviously, you know, a number of leisure trusts that are operating in probably our most deprived wards as well, and it's where, you know, they would potentially want to position themselves if this is a kind of, I mean, 40 across nationally is not a lot, is it? Like, let's face it. But we have got some of the areas where you would think you would land probably one or two of these, in particular. So again, it's where those leisure trusts in those areas may want to have a look at it themselves. So again, without being in that conversation with yourself, Lynn and Adrian so far, you know, I'll pick some of this feedback and take that back to Adrian, and we can come back to you, Lynn. That's all right.
Yeah, that's fine. Yeah.
Well, any other further comments? No, brilliant. Right. Well, I'm just going to save everybody 10 minutes of their lunch hour. So the next CPAN session is on the 13th of July. So that's our July session. And we'll be joined by Stephen Sanford, who's going to give us a bit of an overview of the ICB neighbourhoods model. So again, I think some of the comments that Mark mentioned earlier around how we fit into some of these pieces of work would be really useful. So again, we'll get some some information out to you about the next session within the newsletter. I'll send the slides out that John sends as well, and also the one from the MSK hubs and the information that we've got about that. I'll send that out hopefully in the next week or so. Well, thanks everybody. Enjoy the rest of the afternoon.
Thanks, Darren.
Take care. Thanks.
Thanks, Darren.